Hello, and welcome to the open enrollment presentation for 2020 for plan year 2021 for retirees and emeriti coordinated with Medicare. I'm Gabe Schmidt, the healthcare facilitator for the campus, and I will be executing this presentation. For retirees on Medicare who are living outside of California, if you, the retiree, and your dependents are all on Medicare and are living outside of California, this presentation is not for you. Please contact the VIA Benefits team at 1-855-359-7381 or visit the website my.viabenefits.com/UC and read further information on the UCNet website. Although we will cover VIA Benefits for those who are moving outside of California, the bulk of the presentation is centered around the plans that the university offers for those who are living inside of California. The following topics will be addressed today: open enrollment administration, benefit changes for 2021, making open enrollment changes online, medical plans for 2021, other health and welfare plans, as well as resources. Open enrollment administration. For retirees who are receiving monthly benefits from the UC retirement system, open enrollment began October 29th at 8 a.m. and will conclude on November 24th at 5 p.m. Retirees were mailed open enrollment booklets on October 23rd to the home address listed in the UC Raise system. If perchance you did not receive a booklet mailed to your home address, you can go onto the UCNet website at ucnet.universityofcalifornia.edu/OE and download the booklet for your review. For retirees who are making changes using the UCNA's Retirement at Your Service Online tool, you must have a UC Raise password. If perchance you have forgotten your password, you can request a new one on the website, or you can call the Retirement Administrative Service Center at 1-800-888-8267 in order to request a new password. For rehired retirees, if you are receiving health and welfare benefits as a retiree, you must make changes as a retiree. Open enrollment actions. During open enrollment, you can enroll in or change your medical, dental, or legal plan. You can also enroll eligible family members in medical, dental, legal, or retiree vision coverage. You may suspend your medical or your dental plan. For plan year 2021, and during this open enrollment, retiree VSP is open, as well as the ROG legal plan. If you need assistance with open enrollment or have questions that you would like answered, the Benefits Department is offering 15-minute phone appointments during every Friday throughout open enrollment. You can make an appointment by going to the hr.berkeley.edu website and navigating through the open enrollment icon. Scroll to the page and see the Google Doc that you can sign up for one-on-one appointments. If you're having issues with signing up through the Google Doc, you can reach out to the front desk for the People and Culture Department, which is Kento Ashton, who can be reached at 510-559-0192. Kento can provide assistance with signing you up for one of the phone appointments. As in years past, we will not be able to offer an in-person benefits fair through the campus due to the pandemic. Instead, the Office of the President is offering a virtual benefits fair that can be located at the following website: ucal.us/benefits fair. In the benefits fair, you will see resources such as plan documents, pre-recorded presentations, as well as a chat feature that you can interact with representatives from the various health plans. The benefits fair is open throughout the duration of open enrollment and is available 24 hours a day. Medical plans. Non-Medicare plans are available for retirees and family members who are not age 65 or are not eligible for Medicare. These plan offerings are the same as the ones that are offered to employees. For Medicare coordinated plans, those are offered to retirees and family members who are age 65 or older or are disabled and are coordinated with Medicare. For these plans, you must enroll in Medicare Part A and Part B if eligible. The following plans will be offered for 2021. The non-Medicare plans will offer 2 HMO plans, one through Kaiser and the UC Blue and Gold plan, which is administered by HealthNet, as well as 3 PPO plan offerings, Core, UC Care, and the UC Health Savings Plan. For the Medicare coordinated plans, we offer 2 Advantage plans, the Kaiser Senior Advantage, as well as the UC Medicare Choice, which is a Medicare Advantage PPO plan administered by United Healthcare, and then 3 supplemental plans, UC Medicare PPO, UC Medicare PPO without prescription drug coverage, as well as the UC High Option Supplement to Medicare, which are all administered by Anthem. We also offer the aforementioned Via Benefits Medicare program for those whose families are all Medicare eligible and are living outside of California. Now let's discuss the benefit changes for 2020. Retiree contributions. The UC contribution for both non-Medicare pre-65 retiree as well as Medicare eligible retirees remains at 70%. For those non-Medicare retirees age 65 and older, UC implemented a structure starting in 2019 by which they gradually reduced their contribution over that 3-year period in order to ensure equity across all the different retiree groups. Retirees in this group saw that their share of the medical plan costs increased more than in recent years. The UC Medicare Choice Plan was introduced during open enrollment last year. It's a Medicare Advantage PPO plan that offers Medicare coverage Part A, B, and D. It gives predictable costs and has open access to providers. You do not have to have a primary care physician, and you don't have to have a referral to see a specialist. In this Medicare Advantage, you also have a comprehensive national network of contracted providers that offer the same benefits both in-network and out-of-network, has a single benefit plan with one card that integrates the medical and pharmacy benefits, and it adds additional benefits beyond Medicare, such as gym membership through Silver Sneakers. For 2021, the following health plan ID cards will be in effect. For the Anthem plans, non-Medicare, that is the UC Care, the UC Health Savings Plan, and the Core, all members, new and current, will receive new cards. For the UC Care plan, new plan members only will receive cards for the Health Savings Plan and the Core plan. For the Anthem plans that are coordinated with Medicare, RX card will be sent to all members of the UC High Option as well as the UC Medicare PPO plan. For the commercial Kaiser plan, new plan members only will receive cards. For the UC Medicare Choice, both new and current members will receive new cards. And for the UC Blue and Gold plan, all members, both new and current, will receive new cards for 2021. For the Kaiser Senior Advantage Plan, outpatient prescription drugs with an over-the-counter equivalent is excluded for coverage. These are drugs with the same active ingredient, strength, dosage form as the prescription drug. This does not apply to insulin, tobacco cessation drugs, and an entire class of prescription drugs when one drug within that class becomes available over the counter. For the Medicare PPO plans, the UC Medicare PPO, the PPO without prescription, as well as the high option, Anthem has terminated its Anthem Engage Elite Plus pricing tool. For the other health and welfare plans that are offered to retirees, there's slight amendments for dental coverage. The Delta Dental PPO, the crown and prosthetic replacement frequency change from once every 5 years to once every 7 years. Covered exams were reduced from 4 per year to 2. For the Delta Care USA, the HMO plan, Crown Fusion copay increased from $50 to $150. And for the retiree VSP Vision plan, the Walmart Vision Centers have been added to the network. The ROG Legal Plan, which is open during this year's open enrollment, offered a new program for new diversity and inclusion services that are added to support the needs of UC's diverse population. These include domestic partnership agreements, funeral directives, hospital visitation and authorizations, gender identifier changes on government-issued documents. This is paid in full when working with an in-network attorney. There is no change in the rate for the ROG plan for this coming year. For eligible family members, please make sure that all enrolled family members meet the eligibility criteria outlined on the UCNet website. Audit for proof of dependence eligibility. There are severe penalties if UC finds that ineligible family members have been listed on employees and retirees plans. For those that have overage disabled children, there are plan measures that are offered through the plans in which you can complete documents in order for the child to remain on the plan past age 26. Now we'll switch to making open enrollment changes online. As mentioned previously, you can navigate the open enrollment website through the UCNet website, ucnet.universityofcalifornia.edu. /OE is the official open enrollment website. You can sign into the UC Raise website in order to make your changes. Be sure to have your ID and password. You can watch the following video located on the UCNet website in order to see how to make changes. Once you have navigated to the UC Raise site, you can select the tab for the change that you desire. Be sure to confirm your selection and to print your confirmation. Here is a screenshot of what the open enrollment website looks like for retirees. As mentioned previously, everyone needs a password to access their personal account and to make open enrollment changes through the UC Retirement at Your Service Online account. If you've forgotten your password, you can click on Sign to My Accounts and select Forgot Password from the login page, and you'll be emailed a temporary password. If that is unsuccessful, you can also call the Retirement Administrative Service Center at 1-800-888-8267 in order to get help with the password. Or if you do not have access to a computer, or if you have questions, you can speak to the retirement analyst in order to get your questions addressed. Please make a plan to visit the open enrollment website on UCNet, even if you don't plan to make any changes. You can click on the Open Enrollment 2021 icon, log in and review your current enrollments on the UC Raise site, as well as on the UCNet site, review plan costs and coverage details for 2021. There are different tools that you can use to compare plans and to see changes for the coming year. For those that are enrolled in Medicare and are changing plans, a form is required. The deadline to return the form to the Office of the President is Monday, November 30th, 2020. The required forms for the UC Medicare Choice plan that's administered by United Healthcare is the UBIN 121 form. For Kaiser, it's the Medicare Advantage UBIN 127 form, And for the Anthem Blue Cross plans, you see Medicare PPO, Medicare PPO without RX, as well as the high option plan. It's a UBIN 123 form. Be sure to take advantage of the planning tools that are available on the UCNet website, ucnet.universityofcalifornia.edu, under Open Enrollment. There are various videos that are available. There are tools that help you find providers, as well as links to help you look through plan formularies and to discover intricate details of coverage available to you. Some tips to consider when navigating is to gather your personal data for all your family members, making sure that birth dates and social security numbers are correct. If you want to change your primary care physician, you don't have to do that during open enrollment. That change can happen at any time. If your address needs updating, be sure to log into the UC Raise website and choose My Contact Information and update accordingly. Be sure not to wait until the last minute in order to make changes. Open enrollment ends promptly at 5 p.m. on Tuesday, November 24th. Again, be sure to confirm your choices. Open enrollment changes are only recorded when you confirm them. And so be sure to keep a copy of your confirmation statement. Be sure also to review your January 1st pension statement to make sure that the open enrollment changes are reflected. Medical plans for 2021. The following Medicare retiree plans will be offered for 2021. Kaiser Senior Advantage, UC Medicare Choice, administered by United Healthcare, UC Medicare PPO, UC Medicare PPO without RX, UC High Option Supplement to Medicare, all administered by Anthem Cross, as well as the VIA Benefits Medicare Coordinator Program for those living outside of California who are coordinated with Medicare. Some families have members that are eligible for Medicare, while others are not eligible for Medicare. These are known as split families or partner plans. For the Kaiser Permanente plan, there's the Kaiser Commercial Plan, which partners with the Kaiser Senior Advantage Plan, the UC Blue and Gold Plan, which partners with the UC Medicare Choice, and then for the Core and the UC Care, they're partnered with the UC Medicare PPO Plan. Important note in regards to behavioral health, Optum only provides behavioral health benefits for commercial Kaiser members. The same is not true for Kaiser Senior Advantage. Speaking of behavioral health, all the plans that are offered through the university cover mental health services as well as substance abuse. Provider networks may change when you're enrolled in Medicare. So as mentioned previously, for the UC Blue and Gold plan, the behavioral health carve-out is through MHN, while the UC Medicare Choice plan offers providers both through Medicare as well as United Healthcare. For the commercial Kaiser plan, behavioral health is offered through Optum as well as Kaiser, whereas the Kaiser Senior Advantage, behavioral health is only offered through Kaiser. For the UC Care, UC Health Savings Account, as well as Core, Anthem Blue Cross provides behavioral health. And for the UC Medicare PPO, the Medicare PPO without RX, as well as the UC High Option, behavioral health is offered both through Medicare and through Anthem Blue Cross. If you're moving in 2021, please remember that you must live in California in order to participate in the UC Blue and Gold, the Kaiser plan, as well as the UC Medicare Choice plan. The following plans offer coverage in the US, but also outside of California: the UC Care, the UC Health Savings Plan, and Core, as well as the UC Care, Medicare PPO, and the UC High Option Supplement to Medicare. The UC Medicare Choice Plan offers coverage outside of California, but you still have to maintain a California address. If you are going to be outside of the US, The UC Care as well as the Core plan offer comprehensive coverage worldwide. As mentioned at the start of the presentation, the VIA Benefits Program is offered when all family members are enrolled in Medicare and you live outside of California. In this plan, UC makes an annual contribution to the health reimbursement account for each retiree and each family member. The contribution is subject to graduated eligibility. The maximum amount offered is $3,000 for each participant. The retiree uses the fund in order to purchase a Medicare supplement plan for VIA benefits or a Medicare Advantage plan. The plan can be used to pay for expenses, your Part B premium, or for your outside Part D coverage. Each year, UC determines the maximum amount that will be contributed to our retirees' medical and dental insurance. Some retirees receive the maximum UC contribution, while others are subject to graduated eligibility and receive a percentage of the maximum amount. The amount of the UC contribution depends on the retiree health eligibility rules, the years of UCRP service credit, as well as the age factors. For Group 1, UCRP members were hired before January 1st, 1990, receive 100% of UC's contribution. These are retirees before age 55 that have at least 10 years of UC service credit, or 5 years as a safety member, or retirees at age 55 or later that have at least 5 years of UC service credit. The UC maximum contribution for the Medicare plans is offered for all or some of the family members in Medicare, as well as non-Medicare plans for those who have family members who are under age 65. For those who are age 65 or older that are not coordinated with Medicare, who do not contribute to Social Security while employed, or do not have a family member who are eligible for Medicare. Some of the plans that the university offers result in a Part B, Medicare Part B reimbursement. So if your UC Medicare plan premium is $0, you may receive a full or partial reimbursement of your Medicare Part B premium. For instance, the UC Medicare Choice plan offers a Medicare reimbursement that shows up as a credit on your pension statement. The amount of the reimbursement depends on the total cost of your plan to UC. For Group 2, these are UCRP members who were hired between January 1st, 1990 and June 30th, 2013. They qualify for retiree health and welfare coverage after 10 years of service. This is also based on graduated eligibility, where the percentage of UC's maximum contribution, age plus service credit, equals 75, or 50% of the max. You can find your rate on the UC Raise website. The following graduated eligibility percentage apply based on your years of service. In the instance of your age plus service years equals 75, with 10 years of service credit, it's 50%, and then going up in years of service, it goes up in 5% increments until you hit 20 years service credit, in which case you receive the maximum contribution. So now let's look at a graduated eligibility example for someone that had 15 years of service credit, in which UC pays 75% of the maximum UC contribution. For this example, we'll look at the UC Medicare PPO plan, which has a gross premium of $456.70. At 75% of the UC contribution would be $237.20, leaving a monthly premium amount of $219.50. Finally, the graduated eligibility for Group 3 are for those hired on or after July 1st, 2013, and also employees that are not grandfathered. UC contribution is calculated with this group using the age and service credit, with the maximum contribution at age 65 with 20 years of service credit. The graduate eligibility chart for this group is located on the UCNet website under the Group Health Eligibility Fact Sheet. Now we'll discuss what is Medicare. Medicare is a federally funded program that provides health insurance to people age 65 or older or people with disabilities. It covers most medical services, so you do not have to pay the total cost for care, and it's the foundation for all of UC's Medicare plans. The basic parts of Medicare consist of three parts: Medicare Part A, which is hospital coverage, Medicare Part B, which is medical insurance, and Medicare Part D, which covers prescription drugs. This slide shows the new Medicare card, which was switched recently from your Social Security number to a unique identifier that shows your Medicare Part A and Part B coverage, as well as that unique identifier coverage. Your Medicare eligibility is based on your own work history, the work history of a spouse or ex-spouse. In order to clarify your eligibility, we recommend contacting your local Social Security office. When to enroll in Medicare. We'll consider for employees, those who are eligible at retirement, and those who are eligible after retirement. For active employees, the university recommends that you do not enroll in Medicare Part B, medical insurance, or D, prescription coverage. If your spouse is enrolled in UC Medical Plan, they do not need to enroll. There's a special enrollment period when a UC employee retires. You may enroll in Medicare Part A when you're first eligible, but it is not required. And for those who are members of the UC Health Savings Plan, suggest that you do not enroll in Medicare Part A. For those with same-sex spouses and domestic partners, we recommend consulting with the Social Security Department as to when you should enroll in Medicare parts. For those who are eligible for Medicare at retirement, you and your family members who are eligible for Medicare must enroll in Medicare Part A and Part B. In order to enroll in Medicare, you can go to your local Social Security office 1 month prior to retirement, up to 3 months prior to retirement, in order to complete necessary forms. You can also complete the process through the Social Security Administration website. You complete the UC forms in order to coordinate your Medicare plan. You may also receive a follow-up coordination of benefits form from Medicare. For those who become eligible for Medicare after retirement, you and your family members who are eligible for Medicare must enroll in Medicare Part A and Part B and go to a local Social Security office or to the www.ssa.gov website approximately 3 months prior to turning age 65. If you're receiving Social Security pension, you will automatically be enrolled in Medicare. UCOP will mail you the UC enrollment forms in order to coordinate your Medicare. These are the forms we mentioned before: the UBIN 121 for the UC Medicare Choice Plan, the UBIN 127 for the Kaiser Senior Advantage, and the UBIN 123 for the UC Medicare PPO, the Medicare PPO without prescription, as well as the high option supplement to Medicare. Medicare Part A does not have a monthly premium. The Medicare Part B premium has not been posted for 2021 yet, but the Medicare Part B premium for 2020 was $144.60 per month. This cost may be more for those who have a higher retiree income. This amount is deducted from your Social Security check if collecting Social Security. If not, you are billed monthly. Medicare Part D does not have a monthly premium, but you may incur IRMA Part D income-related adjustment if you have a higher income. The Medicare Part B and D premiums, like I said before, may be higher for retirees with incomes over $87,000 if filing single or over $170,000 if filing married. Monthly premiums. Your UC medical and dental is deducted from your UC pension check, which is subject to graduated eligibility. If you are eligible for a Part B reimbursement for those on the UC Medicare Choice plan or the Kaiser Senior Advantage plan, that Part B reimbursement will be added to your check and show up as a credit on your pension statement. Retiree vision coverage is paid directly to the Vision Service Plan, or VSP. Coordination with Medicare, 2021. For the Kaiser Senior Advantage Plan, you assign your Medicare coverage to Kaiser and cannot use Medicare outside of the plan. For the UC Medicare PPO, the UC High Option Supplement to Medicare, Medicare is your primary payer, and then Anthem Blue Cross is paying as your secondary coverage. For the UC Medicare Choice Plan, you assign your Medicare coverage to United Healthcare, but you can utilize Medicare providers who are either in network with United Healthcare or are willing to bill United Healthcare. You could use Medicare coverage outside of the plan for behavioral health. For your choice of physician, for the Kaiser Senior Advantage Plan, you must select a primary care physician. That primary care physician coordinates your care and provides referrals to specialists when necessary. For the UC Medicare PPO plan, the UC High Option, as well as the UC Medicare Choice Plan, you do not need to have a primary care physician. You can utilize any Medicare physician. A little bit about HMO plans. HMO stands for Health Maintenance Organization. In an HMO plan, you pay a copayment for some products and services. There's no claim forms and there's no annual deductible. You must live or work within the plan service area, and you receive services from network providers. In the HMO plan, you must select a primary care physician who serves as the coordinator for all of your care. The HMO plan offers out-of-area coverage only in emergency services. HMO have set copay for care. For the Kaiser Senior Advantage Plan, for an office, you have a $20 copay. For emergency room and for outpatient service center, as well as inpatient hospital care, there's set copayment amounts. You don't have a deductible, and there's no paperwork or bills. A PPO plan stands for Preferred Provider Organization. In a PPO plan, you have a broad network of providers that allow flexibility to see both in-network and non-network providers. You don't need to see a referral to have a specialist. You have separate annual deductibles as well as annual out-of-pocket maximums. For the UC Medicare Choice Plan, you have a set copayment for products and services. There's no claim form as well as no annual deductible. This plan offers a broad network of providers and allows you flexibility to see non-network providers, provided that they're willing to bill United Healthcare. In this plan, you don't have to have a referral in order to see a specialist. Now let's talk about Anthem Blue Cross deductibles as well as the out-of-pocket maximum. There's an annual individual deductible that you must pay first in order to be satisfied before seeking services, as well as an annual individual out-of-pocket maximum. When met, the annual out-of-pocket maximum at 100%, then the plan will pay the services for the remaining part of the year. Prescription drugs, or Medicare Part D. All the plans that the university offers have Part D or prescription coverage, apart from the UC Medicare PPO without prescription drug coverage. In that particular plan, you can elect it. You still have to provide proof of having an outside Part D plan. For the prescription drugs, no, there is no additional premium. You do not have to run into a donut hole, or none of our plans contain a donut hole. There may be some formulary changes, and there's often ID cards that go along with Part D for those who are enrolled in the UC Medicare PPO, as well as the High Option Supplement to Medicare. For the HMO plans or the Medicare Advantage plans, you utilize one card, the plan that is issued to you. For the Anthem plans, you'll have one card for your supplemental plan, as well as one card for your prescription coverage. If you can't stay away and want to come back to work at the university, you can do so as a rehired retiree, provided the university gets approval. Please review the rehired retiree policy in order to consider that. If returning to work, please consider how your work can impact your medical plan and its coordination with Medicare. You can review the Returning to UC Employment fact sheet that's located on the UCNet website. The following resources are helpful when considering things regarding open enrollment. On UCNet, you can find medical plan information, as well as rates, as well as the complete guide to retirement benefits and the retiree handbook. You may want to consider looking at the Social Security website in order to apply for Medicare benefits and to learn more about Medicare, as well as the rates for the various coverages. You can contact the Retirement Administrative Service Center at 800-888-8267 or send a secure message to the UC Ray web portal. You can contact Berkeley Regional Services at 510-664-9000 option 3, or reach out to me directly, Gabe Schmidt, the healthcare facilitator, at gabe.schmidt@berkeley.edu. Thank you very much for listening to this presentation. If you have questions, feel free to send them to me via email at gabe.schmidt@berkeley.edu.